I would absolutely advocate for a clean slate in setting them up. You know, putting anyone who was really in a position of power, in a position of leadership, back into a position of leadership would be incredibly foolish and, pretty negligent.
These parents are talking about plans for new regional gender identity services for children. Their teenager is currently on a lengthy waiting list for help.
Our daughter started identifying as first non-binary and then a trans boy during the lockdown period. Mm-hmm. Before that, we'd had no indication that there was anything that she was unhappy about. Our child has autism, has had difficulties with mental health, and they're same-sex attracted, all things that we have come to understand are quite common factors that go along with a trans identity.
Their child won't be seen at the Gender Identity Development Service, or GIDS, the only dedicated NHS youth gender clinic in England and Wales. After the service was rated inadequate by the healthcare regulator, the CQC, and an independent review into this area of healthcare led by Dr. Hilary Cass called for a fundamentally different service model, GIDS was officially earmarked for closure last summer. It will be replaced initially by 2 regional hubs, a southern one in London, which includes Great Ormond Street Hospital, and a northern one in northwest England. It was hoped these would replace GIDS in spring 2023, but that timeframe looks unlikely to be met. Hilary Cass has recommended these new services offer more holistic care than GIDS was able to. In her interim report, Dr. Cass identified a number of significant issues with the service. Cass identified that many of the children and young people presenting have complex needs, but once they are identified as having gender-related distress, other important healthcare issues can sometimes be subsumed by the label of gender dysphoria. And an independent group working alongside GIDS told the review that from the point of entry to GIDS, there appears to be predominantly an affirmative, non-exploratory approach. Newsnight has now learned there are concerns over several people appointed to a key role in training the new cohort of staff who will work in the regional hubs. One is a senior clinician at GIDS at the moment who says that social justice underpins their approach to the work and who describes themselves as devoted to an affirmative approach with trans clients. Another person who does not work for GIDS or the Tavistock Trust, has openly questioned Dr. Hilary Cass and NHS England's more cautious stance on social transition. That's the changing of names, pronouns, perhaps the way someone dresses.
Does that strike you as not enough therapy?
Applicants invited for interview for this education role were initially told that Dr. Polly Carmichael, the head of GIDS since 2009, would be on the interviewing panel. She didn't ultimately take part. The CQC rated the leadership of GIDS as inadequate. Dr. Carmichael was also judged by an employment tribunal to have communicated to GIDS staff not to seek external safeguarding advice in the trust. It's understood that Great Ormond Street Hospital, which ran this recruitment process, has now invited external candidates for interview too. And pre-employment checks are underway for candidates who have been offered roles so far. A spokesperson for Great Ormond Street Hospital for Children said, "We want to recruit a wide range of people to the roles of education leads to collectively develop the materials in line with the Cass Review recommendations. While we appreciate they may hold differing views, there will be strong governance processes in place to ensure the curriculum aligns with both the Cass Review and all available evidence." Official board meeting minutes from Alderhay Hospital, part of the Northern Hub, suggest that staff at GIDS' smaller Leeds site will also be involved in the development of new services, but it's unclear how. Like all aspects of this area of healthcare for young people, there is disagreement on what role staff at GIDS should play in the services that will replace it, or indeed whether they should play a role at all.
People involved in the service who are making some of the statements originally made by the service, which have now been so heavily criticised, are now being put in positions of authority in terms of training. I find that almost unbelievable.
Dr. David Bell worked in the adult service at the Tavistock Trust for 25 years. 10 GIDS staff went to him with their serious anxieties about the service. Should those who raised concerns be excluded from working at the new hubs too?
The whistleblowers were the people who recognised the problem long before anyone else did. They were the people who had the capacity to not be dominated by the groupthink and the ideological process. There's something wrong here, and they've all been proved right. So from that perspective, who could be better?
Former Health and Social Care Secretary Sajid Javid told Newsnight that our findings made clear that much needed reform is under threat. Mr. Javid said that individuals who oversaw significant failings at the Tavistock should clearly not be managing the setup of the new system. Appointment processes should be urgently reviewed.
As an organisation supporting the
Some in the trans community, like charity Gendered Intelligence, say talk of who will staff new gender identity services is not their priority.
For us, what's important is that how that staffing is going to work is communicated to the young people. It's how waiting lists are going to be handled and how that's communicated to the young people and to the families. You know, it's how much support is offered in terms of like emotional support, in terms of checking in with people who are on those waiting lists. But what we do want to do is to push for and to advocate for these young people being looked after better.
There are currently around 8,000 young people on that waiting list, some waiting years without any help at all. The Health Secretary, Steve Barclay, says he is clear that the new services providing that help must fully reflect the recommendations from the CAS review, and these, he says, differ significantly to the services provided at the Tavistock. For the families waiting, the sooner they can access that care, the better.